This video is about the signs and symptoms of stomach cancer, and it's the only video you'll need to watch to fully understand them. We'll cover not just the common warning signs, but also the less obvious and uncommon ones that are often overlooked. By the end, you'll have a clear picture of what to look out for and why these symptoms happen. Stomach cancer, also called gastric cancer, often develops slowly over many years. And one of the biggest challenges is that the early warning signs can be subtle and easy to dismiss. So in this video, we're going to go through the most important symptoms, one by one, explain why they happen, and also highlight some of the less common ones you might not immediately think about. Let's start with the major ones. Number 1, persistent indigestion or heartburn. Almost everyone experiences heartburn once in a while, maybe after a big or spicy meal. But when indigestion is constant and doesn't go away with usual remedies, that's concerning. The reason this happens in stomach cancer is that the tumor irritates the stomach lining, which increases acid-related symptoms and makes digestion less efficient. Number 2, early fullness after eating, what doctors call early satiety. This is when you feel stuffed after only a few bites of food. It happens because the tumor takes up space inside the stomach or affects the stomach's ability to stretch. Sometimes even though you're hungry, you just can't finish a meal because your stomach feels blocked. Number 3, unexplained weight loss. This is one of the hallmark cancer symptoms in general. In stomach cancer, weight loss can come from two things. First, you're eating less because of indigestion or fullness. Second, cancer itself changes how the body uses energy, leading to muscle and fat loss even if you're still eating. If pounds are dropping off without you trying, that's always worth checking. Number 4, nausea and vomiting. This can be mild or severe. In advanced cases, vomiting may contain blood, which looks either bright red or like coffee grounds. The reason is that tumors in the stomach lining can bleed or block food from passing into the intestines, forcing it back up. Number 5, blood in the stool or black tarry stools. Bleeding from the stomach isn't always obvious, like vomiting blood. More often, the blood slowly leaks into the digestive tract, and by the time it passes through, the stool turns dark, sticky, and foul-smelling. This is a classic sign of bleeding high up in the digestive system. If you're finding this breakdown helpful so far, please take a second to like the video and subscribe. It really helps us keep producing these straightforward, easy-to-follow lessons. Number 6, abdominal pain or discomfort. This is usually in the upper abdomen, just below the ribs. It might feel like pressure, bloating, or a gnawing ache that doesn't go away. Some patients describe it as a heavy stomach, even without eating much. The pain comes from the tumor irritating nerves or stretching the stomach wall. Number 7, fatigue and weakness. This often comes from anemia, which means low red blood cells. Slow bleeding from the tumor reduces iron levels, which reduces your body's oxygen-carrying capacity. The result is constant tiredness, shortness of breath with small efforts, and a general lack of energy. Now, those are the 7 big ones, but there are several more symptoms worth mentioning. Number 8, loss of appetite. Beyond feeling full quickly, some patients describe a sudden disinterest in food altogether. Even foods they used to love no longer appeal. This can be related to nausea, changes in taste, or just the body's response to cancer. Number 9, bloating after meals. This isn't the kind of bloating you get from too much soda. It's a persistent, uncomfortable swelling in the upper abdomen that happens after eating small amounts. The stomach isn't emptying properly, so food lingers longer than normal. Number 10, difficulty swallowing or dysphagia. This is more common if the tumor is located near where the stomach joins the esophagus. Patients may feel like food is getting stuck or takes longer to go down. Number 11, changes in bowel habits. While not as classic as in colon cancer, some people with stomach cancer experience alternating constipation and diarrhea, especially if the tumor affects digestion and nutrient absorption. Number 12, swelling in the abdomen. If stomach cancer spreads inside the abdominal cavity, it can cause fluid buildup, known as ascites. This makes the belly look enlarged and feel tight, sometimes accompanied by discomfort or shortness of breath. Number 13, jaundice or yellowing of the skin and eyes. This happens in advanced disease if the cancer spreads to the liver or blocks bile ducts. While not an early symptom, it's important to know because it signals advanced progression. Now, to bring it all together. The main symptoms of stomach cancer include persistent indigestion, feeling full quickly, unexplained weight loss, nausea and vomiting, blood in the stool, abdominal pain, and fatigue from anemia. Additional symptoms can include loss of appetite, bloating, difficulty swallowing, bowel habit changes, abdominal swelling, jaundice, and more general signs like fevers or night sweats. The challenge is that most of these symptoms are nonspecific. They can be caused by many much more common conditions like ulcers, reflux, or infections. That's why people sometimes ignore them. But the key message is persistence. If these symptoms keep coming back, don't go away, or get worse over time, they need to be checked by a doctor. Early stomach cancer is much more treatable than advanced disease, and paying attention to your body's signals can make a huge difference. And that wraps up our symptom-focused lesson on stomach cancer. If you learned something new today, share this video with a friend or colleague, and I'll see you in the next one.